Everyone, this is Britt with Integrative PT and Wellness. So I had a few moments in between patients, and I wanted just to share some thoughts, mainly on one of the things that I find myself nearly every day speaking with patients about, and really kind of putting into a nutshell what is it we're doing in rehab, and what am I looking for or asking of patients when they come in. And really, I feel like this holds true whether somebody's coming into me because they were recently in a car accident or a fall or just some specific trauma, or if it's just that kind of nagging injury that's kind of gradually come on over time. Sometimes they know, the person knows why, sometimes they don't. But what I'm looking at with that, what I always try to tell my patients is, hey, either in any of those situations, if we're starting to have pain or problems, for the most part, there's always outliers. I'm not talking about necessarily neurological things, but orthopedic problems, musculoskeletal problems. It really boils down to the stress being placed on the tissue, be it bone, cartilage, muscle, tendon, ligament, is greater than what that tissue can handle. And we at least need to make these hands meet in order for you to feel, at your best. Ideally, we have these hands cross paths, where how much your tissue can handle far exceeds the amount of stress you really ever put on it, or at least for the most part regularly put on it. So when somebody comes in, if we're speaking about, trying to heal, like for instance, we'll say plantar fasciitis, if they're dealing with some foot pain or something like that, we're trying first to calm it down. So we know, hey, that stress right there is more than what it's able to handle. Your body's not able to heal it regularly or to handle that stress. So it just keeps getting more and more painful when it comes in. So that's where I say we've got to try to at least take some of the stress off. Well, how do we do that? Well, that may be one in cutting back volume of activity, be it the foot, be it if you're working out your shoulders, or if it's back pain or something like that, saying, hey, you know what? We at least need to minimize some of the activities that are causing you pain. If that's your foot, if you like to walk a lot or run, we may need to back off on the volume a little bit. If it's the same thing for your shoulder or your back, we may need to limit how much you're working out, change the range you're doing that in, change the weight. Or if you're someone who you're having pain and you can't do your day-to-day activities, hey, how can we, maybe make those a little more efficient, or break up tasks throughout the day so that it's not as painful. You get a little more of a rest break. Other instances, especially if we're going back to the idea of the foot, that's when things such as orthotics or taping the foot, things like that can help to reduce strain, especially in the early stages, to try to quiet the sensitivity or quiet, the amount of action happening in the nerves or noise going on in the nerves there. As that starts to calm down, that's when we want to try to build up the capacity. We want to build up what can those tissues handle. So be that strength training, be that endurance training, be that power training. Usually it's a combination of all of those. And it really, how we do that is based on, one, how are you reacting to it? What are you able to tolerate right now? I always tell my patients, if we're still doing the same exercises, a month from now that we're doing today, something's going wrong. Either, it's we're completely off base as to what's causing the pain, or the program is not right for you, or something's happening. We should be able to progress. Our muscles, our tendons, all these things should be able to gradually, if dosed correctly, gradually handle more stress and more load with that. So that's why, yes, in the beginning, the exercises may seem very simple, especially if I'm trying to just calm pain down or get you comfortable, or especially if you're kind of fearful of doing something. I'm going to give you easier exercises to do, and maybe exercises that you can do each day, to try to help just quiet the system, quiet everything down. As you start to feel better, as you start to gain confidence, that's when we want to start changing that program. We need to increase the amount of stress being placed on that tissue. We can't, have you be able to go to the gym or have you be able to run if you can't raise your arm overhead, or you can't do, or you can't do even like calf raises without causing pain. Well, I know then trying to do it with a weight or trying to run is going to cause problems. Likewise, if it's things at home, if you're struggling just to bend over or to pick up 5 pounds, off the ground, then I know going home and doing a bunch of yard work is probably going to cause a problem. So we have to start where you're at, meet you where you're at, and gradually work on that, and work on not just building up strength and power and endurance, but building confidence. The great thing about it is, for a lot of these, research on these things, it shows that it's not always the destination, but the journey. We don't necessarily find that those people who always get stronger are the ones that feel the best. Sometimes it's just actually doing something tends to help with a lot of these problems. So we're working on that path of at least getting what you can handle to be even with the stress you're putting on that. And sometimes it is all about, well, if I can't change what I can handle right now, then we really have to work on decreasing that stress. And that's really learning about lifestyle modifications, activity modifications. Or if you're someone, you're like, hey, I really can't make many changes. Maybe you have a job that's really hard on you. It's a physically taxing job and there's not a lot of alternatives to how you can do it. Or you're somebody that's like, look, I'm not going to quit going to the gym. I'm not going to quit running. Hey, I work with a lot. I'm the same way. It's worse on me mentally if I don't do those things. So if that's your stress relief, or you just know you're not going to do it, then we've really got to work to build up the capacity of what your body can handle. And that's something you have to be patient with, because it doesn't happen quickly when that's going on. Where the sweet spot is when you finally meet, those hands meet, and you're like, hey, you know what? I'm feeling pretty good with those activities that I normally do each day. That's when continuing exercise really makes the biggest difference. Far too often I see is people start to feel better, they kind of fall back into the habits they had before. And look, that's normal. You're human. If you're not somebody that loves to go, push it to the gym and is motivated to do it a lot, or is, wants to progress, or that's not your jam, that's okay. You're more common than the other people that do. But where we try to find, at least myself, I know my partner, we try to find, well, what's that program that you not only can do, but you know how to progress that. You don't necessarily have to see us to do it, but you know how to progress that. Because as your body's getting stronger and you're building, power, endurance, confidence, all these things out of your body, then it's going to be a little less likely that those day-to-day tasks you do are ever going to bother you, because you've now surpassed the amount of tissue tolerance of what can your body handle now has surpassed what's asked of it most days. And maybe there's that time where you're like, hey, you know what? I don't go hike 5 miles very regularly, but I want to try that this weekend. Well, if you're somebody you've already kind of been working on pushing yourself a little out of your comfort zone to get stronger, more flexible, more powerful, then it's less likely that time you choose to go do that, 5-mile hike, or you go choose to do a bunch of yard work, and maybe that's something you haven't done all season, less likely you're going to have a lot of problems out of that. So that's what we're trying to get in a nutshell. Anybody that comes to our office, there's always different ways of trying to achieve that. For some people, for multiple reasons. Some people it's faster than others. Sometimes we just know, hey, there's only so much we're going to be able to progress you, so we got to learn how to compensate for what we can't. But that's the key. And so again, we want to make sure first, if you're coming, we got to calm it down. Then we got to start building it back up, and we need to be able to progress that as you go. So, I've run into this on a daily basis. I give this talk a lot on a daily basis. So I wanted to put that out there. So hopefully, if you're working with a therapist or a trainer or somebody, or you're dealing with pain, kind of what's the expectations, what's the process.